Welcome to the SLX Aligner Records video on taking PVS impressions. In this video, you will see how to take PVS impressions with the two-step method. For your setup, you will need disposable trays, upper and lower, putty, and light body. I have chosen fast set putty and fast set light body. We will start with the upper impression. Measure out equal amounts of putty material using the scoops provided. When you're ready, start mixing your putty. Here I am mixing the Panasil putty. The benefit to using a putty is that it is quite thick and doesn't flow into the palette as much when inserting, keeping your patient more comfortable when taking the impression. Ensure all the material is a uniform color, then roll into a cylinder and place in the disposable tray. For aligner impressions, you need coverage on the teeth only and do not need to include most of the palette. I will use some of the material around the middle portion of the tray to later make sure the light body does not flow too much into that area. Insert the impression tray. Unlike other materials, the putty is thick and requires firm pressure to seat the tray. Check that the material has set and remove the tray. Now for the second step. Use the light body to fill in the area of the impression where the teeth are. With this method, you have the benefit of seeing exactly where the teeth are and can place the light body accordingly. The light body also flows around the teeth and does not tend to flow too much into the palate area. I place some of the light body on my glove so I can make sure the material is set before I remove the tray. Insert the tray again and make sure it is fully seated. The material will set faster inside the mouth due to the higher temperature. So when it is set on my glove, I am sure that it is set inside the mouth as well. I am using the Panasil Initial Contact Light Body. This material is hydrophilic, so it will not capture saliva bubbles and you do not have to dry the teeth for an accurate impression. Now for the lower impression. Follow the same steps as we did for the upper. You will always need both upper and lower impressions for submission, even if you are only treating one arch. With the one-step method, you would create an indentation in your putty for your light body and insert both materials to set at the same time. The drawback to this method is you have little control over where the light body flows. Often you will need to insert the tray with more light body to ensure a detailed impression. The light body also has the ability to flow into the patient's palate, which is less comfortable for them. Check your impressions for accuracy. Ensure there are no pulls and that all the teeth are captured. You will want at least 1 to 2 millimeters of gingival tissue as well. For bite impressions, make sure the patient knows where their natural bite is. I have them first bite and explain that this is the bite we are looking for. Extrude the material on a surface or glove first, and then proceed to extrude the material on the biting surfaces of the teeth. Cover the entire arch and have the patient bite. I am using the Futar fast set material for the bite registration. Once the material has set, the patient can then open and the bite registration is removed. For all submissions, you will need an upper and a lower impression with a bite registration. Send with your SLX Aligner lab slip.